Hi guys, wearing the badge with pride. Well done boys. Next weekend is going to be a bit of a task. New Zealand look unstoppable. Well, you'll have my support, but if there's one side you don't mind losing to, it's got to be New Zealand. They play some beautiful clinical rugby. So, yeah, good luck, boys. Most of my guys have presented to their GP prior to coming to the men's health clinic. They've often presented with the cardinal symptoms of low testosterone. The most prominent symptom is an element of mental illness. Now, it can be mild, it can be moderate, it can be severe, but those three elements include low mood, anxiety, and depersonalization. Now, your GP sees in front of him what looks like a fit chap who is just down on his luck. Your GP will screen you with the routine screening questions. Are you tired all the time? Are you sleeping? Are you eating? Etc. etc. There's a depression screening tool that the GPs use. It's the PH9 screening questionnaire. And it's a tool that gives your doctor some quantitative markers to allow him to effectively diagnose depression, anxiety, depersonalization, all these things. Because mental health is complicated. Let's not kid ourselves. There are lots of elements that contribute towards mental health, and this screening tool gives the GP something tangible, something to say, yes, you are depressed, you would warrant talking therapies and or antidepressants. So often my guys have been offered antidepressants. Some of them have accepted, lots have declined, and they've declined because they don't feel that they're depressed. They feel that something else is going on and it's not depression. Things in their life are going to plan, but they're not going to plan. There's a disconnect, but they know they're not depressed. So what happens if you do accept antidepressants? Now, antidepressants 100% have a place in treating mental illness. But that place is not as prolific as one would think from the number of prescriptions for antidepressants that are issued, I'm sure, on a daily basis. So, what do the antidepressants do? Well, the selective serotonin reuptake inhibitors obviously flood your system with serotonin. And that is the happiness chemical. Without serotonin, you would not be happy. So surely flooding your system with serotonin is something that you should want to achieve. And you can make an argument for that. And you can also make an argument against that. Now, what is the argument against that? The argument against that is the blunting of life. You should be able to respond appropriately to highs and respond appropriately to lows. You need to be able to be passionate. You need to be able to be sad, reflective. Emotions. Life is all about emotions. And when you flood your system with a certain drug, and whether it be serotonin, which is the happiness chemical, there is a disconnect. What is that disconnect? It's because you don't respond appropriately to exogenous aspects of life that you should respond to. You should be sad when something sad happens. You should be elated when something happy happens. When happy happens? Say that 3 times real fast. So it's not uncommon for guys with mild depression to come back to the GP and say, not really seeing any benefit from these antidepressants. And it's because you're blunted. Whilst you may be lacking serotonin because of X, Y, Z, the antidepressants often have a blunting effect. And so you recognize, your brain recognizes that you're not actually responding appropriately to highs and lows. And there's discourse in your brain or in your psyche, and it says, no, this isn't right. So antidepressants 100% do have a place in treating depression and anxiety and depersonalization, but they are dished out like Smarties by doctors because outwardly they see a healthy looking chap. Often guys obviously have muscles, they have a beard, there doesn't seem to be anything outwardly wrong, and that is the problem. Okay, it's a very superficial window that we present, and your GP has only got 10 minutes, if he's lucky, to listen to your problems, identify whether there is a diagnosis that he can do something about, and what's the obvious answer? Talking therapies and antidepressants. Your GP is essentially a puppet, and the puppet master is the pharmaceutical industry. Sad but true. That is the nature of modern medicine, this curative rather than preventative model that we should be adopting. Your GP does not have time to adopt a preventative model when it comes to mental health, which is sad. It's very sad. Now, I'm not going to trivialize mental health by saying it's always going to be low testosterone. It's always going to be high testosterone. It's always going to be high estrogen that is the reason why you are depressed. Mental illness is extremely complex. But what I would like is for doctors to adopt a more progressive attitude towards dealing with mental health issues. Rather than dishing out antidepressants willy-nilly, I think we should be looking for a cause. Now, there will obviously be a psychosocial element to it, but surely we should be looking for a physical cause. So screening bloods, full blood count, have a look to see if that patient's anemic. Make sure they're not tired all the time because they're anemic, and then look to find out why they might be anemic. They may have some sort of infection that needs to be addressed. An infection is going to make you feel lousy. Thyroid, hypothyroid depression, hyperthyroid anxiety. Simple blood test. Don't just do a TSH. Do a T4 and T3. T3 is overlooked, mumbling free. TSH is just a snapshot. It's just telling your thyroid to produce T4 and T3. T3 is the important one. Look at testosterone. Obviously I said I'm a testosterone doctor, but my word, there is a clear association between mental illness and low testosterone. It needs to be addressed. if you could reverse it, you would reverse a lot of mental health problems that are being masked by antidepressants and or talking therapies. Talking therapies will not be effective without addressing the cause to the depression. This should not be rocket science. Estrogen. Now, the NHS does not recognize the importance of estrogen in testosterone replacement therapy, which I think is scandalous. Testosterone gets aromatized to estrogen. Estrogen feeds back to the hypothalamus and pituitary. It's a negative feedback system, and then if you've got too much estrogen, your brain says, no, do not send LH and FSH down to the testicles. If you've got too little, it should respond and say, send LH and FSH down to the testicles. LH obviously being primarily responsible for the Leydig cell production of testosterone, and FSH for the Sertoli's production of sperm. But it's a little bit more complicated than that, but that's all you really need to know. But estrogen, high estrogen, the cardinal symptom of high estrogen is anxiety. My guys know that when they get the spike, and I know when they've got high estrogen, because they become whiny little. And when we control their estrogen, and I mean control it, not tank it, not crash it, control it with microdosing of exemestane if indicated. If there are lifestyle things you should be doing them. Drugs are a last resort. Drugs are sometimes necessary to allow you to address your lifestyle. So you have to have a logical and methodical approach, but it also has to be progressive. So you also have to recognize the fact that sometimes you need to use medications in order for that patient to address the things that you've told him to address. I hope that makes sense. So I am sure that there is a cohort, a massive cohort. It's a silent epidemic of guys, not only with low testosterones, but low testosterones to relative high estrogens. And there are guys with relatively normal testosterones to a high estrogen, and this is causing a lot of issues in our society. Estrogen is a major problem, and it's under-recognized and overlooked. So, how do you lower estrogen? Move, you chunky monkeys, move. Weight management. Now, weight management isn't actually moving. Weight management is diet with a little bit of moving afterwards. The primary way of losing weight is addressing your diet. Now, if you follow these videos, you follow the group, I'm a big advocate of low carb, high fat and intermittent fasting. Now, apparently we're not allowed to say intermittent fasting anymore, so time restricted eating. This is the most effective way in my mind to lose weight and maintain healthy hormone levels, which is what this is all about, alongside improving mental health. Primary drives when you wake up should be to go get food. If you get food at 8 o'clock and you treat 8 o'clock as the most important meal of the day, you've lost that drive. You've lost that need for cortisol. You've created an insulin spike too quickly. What else is there to do? Well, you can have sex. So, have sex. But I mean, once you've done that, what else are you supposed to do? So, stay alert, stay focused. So I like 16-8. I'm actually trialing 23-1, so 1 meal a day. And I'm loving it. But you cannot have a one-size-fits-all model for nutrition, much like you cannot have a one-size-fits-all model for testosterone replacement therapy. You need to apply principles and adapt those principles according to the individual. Thinking. evolving. No rules, principles. So, what are we talking about? What are we banging on about? Mental health, highs and lows, normal levels, normal, not boring, normal. Why is normal interesting? Why is normal something you should aspire to? Normal shows an appreciation that we require balance. You want a high testosterone? Do you want a high testosterone? No, you don't want a high testosterone. You want a normal testosterone. Why do you want a normal testosterone? If you think about catabolic and anabolic processes, you're not 50% anabolic, 50% catabolic all the time. You have a period of time where you're predominantly anabolic, and you have a period of time when you're predominantly catabolic. If we were supposed to be 50% and 50% constantly, then we would have evolved to be 50% anabolic, then 50% catabolic. Balance, homeostasis. We talk about that a lot. I bang on about it constantly. It's an appreciation that the body wants to establish balance, stability. Only then can you fully appreciate the nuances, the beauty of life. I'll start singing in a minute. I won't start singing in a minute. It's something that we do need to appreciate. So from an antidepressant perspective, flooding your body with serotonin, it may temporarily alleviate the negative symptoms that have arisen because of a subsequent lack of serotonin, but it doesn't address the cause, and it blunts your brain. Much like guys with high free testosterones. Now, we all know guys banging in gear down the gym. They're great when you agree with them. They're not great when you disagree with them. We all know proponents of high testosterone on the internet, and they don't appear calm. They don't appear confident. They appear overly confident. And when you challenge their theories, when you challenge them, they get aggressive, rather than having the ability to be objective. It's my way or the highway. Having fixed beliefs shows not only a lack of intelligence, you lack the ability to empathize. And when you lack the ability to empathize, you're not really a productive member of society. Because life is all about community. It's all about communication. We have evolved to be a species that lives in communities. Why is that? Well, it's because there was a survival benefit, a survival need to be in a community. Now, what have we done with these communities? The bigger the community, the more division there is. If you look at sports, look at football, where xenophobia abounds, football violence, team against team, people fight vehemently to protect their reputation, they scrap, they get very upset. Don't like football. Sorry. Don't. I mean, when I went to public school, can you tell? And it was only the guys that couldn't play rugby played football, so I've always think it's sort of as an inferior sport, but I do think of it as an inferior sport for a number of reasons. Not only does football encourage xenophobia, I don't think it's, from a sportsman perspective, as strong as rugby. Professional fouls, dives. It's not very sportsmanlike, isn't it? You know, I think rugby is more an example of how you should live life. You need to attack. You need to constantly attack. The game is never over until that final whistle. You can play a defensive game. What happens when a rugby plays defensive games? You get beat because the other team is going to attack. So, again, crowds, rugby crowds, you know, you can have an Englishman next to a Kiwi next week and there'll be no aggression. You can have a scrap on the field. Who doesn't like a good scrap on the field? These beasts kicking each other, punching each other. It's great fun, isn't it? And what happens afterwards? The referee gives them a rollicking, and you've got these monsters and this tiny referee. And what are these monsters doing? Saying sorry. They're because they don't want to be thrown off the game, so they apologise. These you know, and you compare that to football. Jeez, shouting, swearing at the referees. Oh, but it's just passion. No, it's not. It's lack of class. In rugby, they want to stay on the field. They want to support their team. They want community. And what happens afterwards? They shake hands. There's no animosity. So I think rugby teaches you more about life than football, in my opinion. I mean, obviously I'm alienating a whole load of football fans, but I couldn't care less. I'm a rugby boy. But I think rugby teaches you about life. So community. We should protect our community. But we shouldn't be dismissive or aggressive towards other communities. We should have a level of acceptance that we don't appear to have, and that's one of the things that's indicative or wrong about our society. Is we try and protect rather than accept. So be kinder, be nicer, be gentler. I put this on the group. The butterfly effect or the chaos theory. You know, do something nice today. Do something nice without expectation of reciprocation. It will make you feel better. I promise you. And what you will do is you will spiral. You will spiral a wave of positivity. You will actually affect a change to the collective by just adjusting your mindset. Doing something for somebody else without the need to be thanked, the need for something in return. This is what our society lacks. It's indoctrinated in us to protect, to be worried. The news is full of fear-mongering, disaster, bullshit about Brexit. It's deflecting us from the truth. The truth is, we just need to be kinder to each other. That's fact. And then all these unsurmountable issues, all these things that we believe that we cannot affect a positive change to, they will change. But it's going to take an individual to change the collective. And if enough individuals change the collective, that unity will bring about change. It's a perspective. It's a life perspective. You can say I'm talking garbage, but I'm pretty sure I'm talking sense. It's the first time for everything.